and welcome to another episode of the Basildon Council's official podcast. I'm your host Ryan, and joining me today, I'm pleased to say, is the chair of local mental health charity Basildon MIND, John Birkett. John, how are you today?
I'm very well, thank you. Thanks for inviting me.
No, all good, all good. It's a pleasure to have you. It's something with today's episode that I think is so prevalent to today, to make sure that, you know, mental health is such a big sort of topic, and there's a lot of stuff to cover. So we're going to try and break down a few things, but for you, just off the bat, sort of how important is sort of mental health and looking after that?
So I think it's really important. Our vision as Basildon MIND is of a society that promotes good mental health for all. And so it's critically important. It's what we do. That's why we're here.
Excellent. And so looking at Basildon MIND and being the chair of it, I'm going to hope that we know what we're talking about.
We do.
How important is sort of like Basildon MIND? Like what does it do? So what's their purpose? Like, tell me about, if no one's heard of Basildon MIND, what's the deal?
So we are a local mental health charity. As I said, our vision is about promoting good mental health for all. And actually, we've been doing that for a long time. We've actually been around since 1970, helping local people with their mental health. We are a local charity, registered as a charity, and we are affiliated to the National Mind charity. So the National Mind charity do things like fundraising, and they do awareness and setting policy. And about 100 what we call local minds, they actually deliver the services. And Basildon MIND is a local mind, and we deliver services in the Basildon, Billericay and Wickford area, mental health services.
That's brilliant. And so, I mean, I think a lot of people might be surprised also to find out that it's been around for such a long time.
Yes.
Which sort of, I think, lends to this idea that when we think of mental health now, we think it's quite a sort of a modern phenomena, but it's not. Mental health is a thing that people have been dealing with for a very long time, and they have for as long as that's been happening, people willing to help others. I think people will be interested and shocked to find that out.
Yes, I think that's very true. There's, mental health is no different from physical health. I think just luckily for us, it's more spoken about. Lately, there's been some much more sort of media coverage about it. But mental health, the same as physical health, it's been around forever. And people need just as much help with their mental health as they might with their physical health. And in fact, we believe there is a connection between physical and mental health. And if we try to help people improve their physical health, we hope that will also improve their mental health. And when we talk about some of our services in a minute, I will demonstrate how we try and do that.
Now, we on a previous guest we had, Pam Green, sort of had a very similar sort of approach when it was looking at your lifestyle and how you live can also be relevant to your mental health and your health overall. You know, if you don't have your eggs in a row kind of thing, if everything's not sort of grand or tickety boo, if things are not quite working right, that can affect our health overall. And then say if you've got poor physical health, maybe that can also have poor mental health. We met just before Christmas for the first time.
We did indeed.
We mentioned about sort of people tend to forget that mental health is as equal as physical health. It's very quick and easy to go to your doctors and say, I've got a tickly cough. That can be sorted. But when we say just something's not right, I don't feel quite good, that can be really hard to explain sometimes, and that's where a lot of people could struggle.
I think it can, and I think it's easy to sort of to let your mental health creep up on you. It's easy to sort of maybe stay indoors, to have less social interaction, to be by yourself, and we try to encourage people to be aware of their mental health and to do some activities that will improve it, like getting out and about, do some exercise, meet other people, family and friends, engage, and things like that, and they will actually help your mental health just as much as sort of having a walk or something would improve your physical health. So it's always been there. I think it's good that it's spoken about more now, and that's what we're here for. We've been here for a long time doing that, and we're not going anywhere.
Excellent. Well, let's look at, we say we've been around for a long time, so we've managed to by that point figure out what it is we do. So if someone was to come along to Basildon MIND and say, look, I need some help, what kind of services do Basildon MIND offer? What can they expect to find there?
Okay, so we offer a number of services in the Basildon, Billericay and Wickford area. So they include a helpline, we do counselling, we do supported housing, we run a number of walking and talking groups, an allotment project, We've got a pop-up in Billericay, and then we run a number of NHS funded services. So I'd like to just spend some time maybe stepping through those and describing those in a bit more detail, because I think they're quite important.
Absolutely.
So first of all, the helpline. So you can call our helpline anytime. If it's not manned, then there's an answer machine, and the helpline provides things like a listening ear, so people just phone up for a chat. Some people phone up and it's better to be signposted to other organisations that can better help them. And other people, we sign up to our counselling service. So the helpline is really the sort of way into our services, and that's a telephone helpline, and there's also you can do it via an email address or via our website. Counselling, so we counsel children and youths free of charge between ages of 7 and 18, and that's something that's definitely needed in the local area, and we have some real expertise counselling people, helping them with their mental health, helping children. We also counsel adults for a very low fee of £5 an hour, and we also run a private counselling service. Now, all of our counselling services have the same, you get the same service, which is around 12 one-hour-long sessions with a highly trained counsellor. And those sessions normally take place either in our counselling suite in Whitmore Way, in Basildon, or via Zoom. So counselling is a really important service that we offer. We also offer supported housing. So we help people with lived mental health experience that aren't yet ready to live independently. We run several weekly walking groups where we walk around the local area, and afterwards we go for a cuppa and a chat. So there's physical activity followed by social interaction. And our walks are really different because they are attended by a very experienced counsellor who can talk to walkers about things that are going on in their lives. And we call that walking and talking, and I think it really makes our walks different and special. And as I was saying earlier, that's the combination. There's a physical health, social interaction, and mental health, and that's a really important activity that we do. And we run several walks a week, and we are planning more. And in a similar vein, we also have an allotment project, which is as much about social interaction as it is gardening, where people come along, we do grow vegetables, but we also spend lots of time talking to each other and having refreshments and just sort of getting out in the fresh air and enjoying ourselves. So we do that as well. We also hold a weekly pop-up in Billericay High Street, which is a bit like our helpline, so local people can come in, they can have a cup of tea and a chat and sort of get the listening ear. We can signpost them to other services or our services, or we can sign them up for counselling. And then finally, in conjunction, in partnership really with other local minds, so I mentioned these, that there are local minds that deliver the services across the UK. In conjunction with some other local minds in Essex, we run a number of NHS funded projects where we can help people with their mental health. So we have something called mental health recovery, where people come out of hospital, we help them reintegrate into the community. There's something called positive pathways, that's short-term intervention for people that need help. We have a crisis sanctuary where people can either call or go in to get help if they're in a crisis. And we even have a crisis sanctuary house where people can go and stay for a few nights if they really need to be away from home. So we run a range of services trying to help people with their mental health.
Genuinely surprised by how many different services there actually are.
Yes.
One thing that just jumps out to me, and as someone who has dealt with mental health before, we've spoken about it before.
Yes.
The one thing that really jumps out to me is, of all these services, there's one thing that like really stands out all the time, and it's just that sociability and that communication.
Yeah.
And I find that yes, having professionals is helpful and getting that help, but the one thing that I think always really underlines a lot of that is communication, just talking to someone.
Yes.
And I wondered if I could just go off on a side note there, like how important do you think just talking to someone is in terms of dealing with our mental health.
Yeah, well, it's certainly, you know, they say it's good to talk, and it is good to talk. But I would give you an example, which is that another service, if you like, that we have is we have a charity shop. And our charity shop raises really important funds so that we can fund, for example, counselling children. And our charity shop is run by a team of around 20 volunteers who all come into the shop. And it's as much about them helping us run the shop as it is actually social interaction between them. So they come in, they talk to each other. Lots of them have lived mental health experience, and they really demonstrate to me that talking about it, you know, talking to fellow people, just you know, getting it off your chest is a good thing to do, and it's the beginning of getting help and sort of feeling better. So I think that there's nothing better than talking about it, and sometimes it's the hardest thing to do, but
Absolutely.
once you've kind of gone over the threshold and started, then you're on a journey to something better. And I would really encourage people to try to talk about it. You know, call the helpline, talk to a friend, contact your family, just try to start the process.
And you say, and we've seen this, just starting sometimes can be the hardest thing.
Yeah.
But I think for a lot of people, maybe not necessarily realising, just maybe talking to your brother or your mum.
Exactly.
It's a start. It's something, and that can help, and we can get on the way. I wondered if we can sort of just talk on how Basildon Mind is for everyone. It's inclusive of everyone. Anyone can come along. It's not exclusive at all, is it? It's
not. So basically, as I said, our vision is of a society that promotes good mental health for everyone, for all. So that's what it's for. And I guess maybe to demonstrate that we really are for everyone, I'd like to talk to you about our values. So Basildon Mind have 5 values, and I think they demonstrate that how we work and what underpins all of our activity. So the first one is that we are open, we reach out to anyone. So there you go, that's anyone. We work together because we are stronger in partnership. So, you know, we can't solve everything by ourselves. We work together with other local charities, with other local minds to try to help local people with their mental health. We are responsive, so we listen and we act, so we try to tailor our services to what's needed. We are independent, we speak out fearlessly, and we're not told what to do. We're an independent local charity, we're more than 50 years old. And that brings us to the last one, we are unstoppable. We will not give up, we've been here a long time, and we're not going anywhere. So hopefully those values show you that we are here to help local people with their mental health. That's what we do.
Absolutely. It's so good as well that mental health is for and affects everyone. And,
definitely. Definitely.
When we say everyone as well, what are some common stresses that we tend to see? Are there things that with daily life that are a problem that can affect us? Is it a case of something as simple as it's a few more days till payday and that's kind of stressing me out a little bit, that can have an effect?
I think, we have a what we call a list of presenting problems, and there are about 40 of those. But really, I think there can be lots of things that affect your mental health. So maybe the headlines talk about anxiety, depression, whatever. But really, there are a number of things. And statistics from the National Mind charity that we are affiliated to, and we have to follow their quality standards, they show that approximately 1 in 4 people in the UK will experience a mental health problem each year. 1 in 4, that's a lot. Yeah. And that's before we had the COVID pandemic, the cost of living crisis. So there are really lots and lots of challenges out there, and we understand that, and we're here to try and help.
Yeah, and I think it's important, and we mentioned this very briefly at the beginning, that mental health has been around for a long time, and this is something that it's not a new thing. It's just that we're more aware of it now, and we're dealing with it. I think is probably why we're seeing a lot more of it in the news recently, and over the last couple of years. So I think it's important to realise and acknowledge sometimes if we're struggling, it's okay to struggle and it's okay to ask for help. I wanted to just on that talk about early intervention. Sort of, how important is it that we're able to try and recognise when we're starting to feel like something's not quite right, and how long should we leave it? Do we leave it at all? Like, how important is it to really just go, I'm kind of struggling, I could probably do with some help, rather than suffering alone?
Okay, so I think it's, I think mental health has always been out there, as I said, but it's become more acceptable to speak about it, and there's been some sort of more media attention to it. When to get help? Well, I would say it's maybe the same as going to the doctor. If you have a physical problem, you might leave it a day or two, or you might phone up on the first day and try to get help. I would say if you're feeling anxious, you're feeling depressed, or something with your mental health, you should try and do it quickly. And I think it is good to talk. The sooner that you ask for help, the sooner we can try and help you. So I would say don't leave it too long. Just think about it and try to get in touch with us. Try and contact Basildon Mind or someone else. Talk to someone about it, and we can try and help you.
And how can people get in touch with Basildon Mind? Yeah,
so there are several ways to contact us. The helpline is the telephone solution, so you can call our helpline on 01268 284 130. We also have a website that you can contact at www.basmind.org. We have a very active social media presence. We're on Facebook, Instagram, X, LinkedIn. We have even some really good TikTok videos around our charity shop. So there are a number of ways to help us, to contact us. And I would say we're good listeners. We'd love to hear from you. So whatever suits you, just try to contact us, and we'll get back to you.
Absolutely. And if at all you missed any of those links that John's just referred to that were on the screen, they are in our description and post text as well, so you can get access to those there if you missed them. Well, I think there's about where we'll leave it there. But thank you very much for coming in to join us and speak with us about mental health today. I think it's so important that people can start to acknowledge it, and I think the more we talk about it, have people such as yourselves on to start to identify some of these little stressors, or maybe if you're feeling so, go and get some help. Like, people may go, actually I have been feeling so, and that might encourage them. So thank you for coming on.
I hope so. I mean, we want Basildon, Billericay and Wickford to be the best place for talking about and taking care of mental health. That's as simple as that. Please, I'm pleased that you invited us here. Hopefully this has helped some of the listeners to understand that there is help out there. Think about calling us, and we'd love to hear from you.
Excellent. Well,
and I'd like to thank you for inviting us as well, and to to talk about this really important subject, because even though it's more prominent now, there's still plenty more opportunity to let people know that help is out there. They're not alone. So thanks for your good work on that.
No, absolutely, it's been a pleasure. It's a pleasure as always to see you again. Thank you, and thank you for watching. As John mentioned, if any of this has been helpful to you, if any of this has been relevant at all, like I say, there are links, of course, in the description and post text for this video that you can go and have a look at those. Please do get help if you are feeling a little bit overwhelmed, or you feel like you need to talk to someone. Basildon Mind is here. Speak to a doctor, speak to a friend, speak to your mum, whoever is around to get talking. Thank you very much for watching, and we'll see you on the next one.